It's 2 a.m., you're lying in bed, and suddenly, you feel something moving. Inside your ear, not an itch, not pain, movement. Most people's first instinct is to panic, jam a finger in, and try to dig it out. That single reaction is exactly what turns a harmless situation into an emergency room visit. Because here's what nobody tells you. The human ear is basically a dead-end tunnel, and whatever goes in doesn't always come back out on its own. This isn't rare. Ear canal insect intrusions are one of the most common reasons people rush to the ER at night, because insects are naturally drawn to warmth, moisture, and the smell of earwax. Your ear canal is warm, dark, and humid. To a small insect, it looks like shelter. Cockroaches are the most commonly reported culprit, followed by ants, moths, and small beetles. And it almost always happens at night, because that's when people are lying still and insects are most active. The insect doesn't explore your ear and leave. It gets stuck. And because it's still alive, it panics too, which means it moves fast against your eardrum. Most people's first move is wrong. Sticking in a cotton bud, a finger, or tweezers to grab it. Here's why that backfires. Your ear canal curves. It's not a straight tube, it's S-shaped. Anything you push in doesn't pull the insect out. It pushes it deeper, closer to the eardrum, increasing the risk of rupture, bleeding, and infection. The second myth, waiting it out. Some people assume the insect will just die and fall out. Sometimes it does, but if it's still alive and moving, every movement scrapes against the eardrum, and that's what causes the sharp, disorienting pain people describe as the worst pain of my life. Doctors agree on one method that works in the vast majority of cases: oil, mineral oil, olive oil, or baby oil, a few drops, at room temperature, poured gently into the ear while lying on your side. Here's the mechanism. Insects breathe through tiny openings along their body called spiracles. Oil blocks these openings almost instantly. The insect suffocates within seconds and stops moving, which immediately stops the pain, even before it's removed. Once it's no longer moving, the ear can be flushed with warm water, or the insect will often float out on its own with the oil. This one piece of information is the difference between a 5-minute fix at home and a late-night ER visit. There are real red flags that mean this isn't a DIY situation anymore. Sharp, worsening pain that doesn't ease after the oil method. Blood or fluid draining from the ear. Sudden hearing loss or ringing that doesn't stop. The object is not an insect, but something solid, a bead, a seed, a small toy. In those cases, the oil trick can make things worse, not better. And it needs a doctor with proper ear instruments, because pulling blind with tweezers is how eardrums get punctured. Your ear canal has natural defenses most people never think about. Earwax itself is part of this. It's sticky specifically to trap small insects and debris before they ever reach the eardrum. The tiny hairs lining the canal also work to physically block intruders, so the ear isn't as vulnerable as it feels in that 2 a.m. panic moment. It's actually built with its own security system. Most people just don't know how to work with it instead of against it. So next time this happens, to you or someone around you, you'll know, don't dig. Don't panic. Oil first, doctor, if it doesn't resolve. If your body has been trying to tell you something and you've been ignoring the signs, that's exactly what this channel breaks down. One body mystery at a time. Subscribe, because the next one might explain something happening to you right now.